Today, we will talk about solution-focused brief therapy. And in order to introduce this therapy, I would like you to start with an exercise. So indulge me, please, and close your eyes. Close your eyes and imagine for a second that all your emotional difficulties, all your psychological problems have disappeared. They have vanished as if by a miracle. How do you feel? Picture yourself. Where are you? What color clothes are you wearing? What kind of clothes are you wearing? What can you smell around you? Who are you with? How do they know that all your emotional difficulties have vanished? How do they know that a miracle has happened and you no longer suffer from whatever it is that you experienced, whether it was anxiety or depression or OCD or what have you? And this imagination exercise is not about things like whether or not you have a job or whether or not you have money or so on. It is only about psychological problems. And all your psychological problems have vanished. And that is what I want you to focus on right now. Okay? So let's develop that a bit further. On this day that you are problem-free, what are you doing differently? What activities are you undertaking that you weren't able to undertake when you had the problem? And now that you're problem-free, what new things might you be undertaking? Okay, so open your eyes and let's talk a bit more about solution-focused brief therapy. If you're a therapist, this is a really, really powerful therapy to use when nothing else seems to be working. I personally feel that it focuses the client on their therapy goals and creates a lot of motivation. A lot of people use it as a standalone therapy. Many use it as a set of techniques to be used during an eclectic therapy practice. In any case, let's talk about solution-focused brief therapy. So first of all, we need to understand the concept of problem space and solution space. See, the problem space includes things like when the problem started, what's the nature of the problem, how often it occurs, how old were you when this started, what were the precipitating factors, what are the antecedents, what are the origins, what are the triggers, what are the maintaining factors, and we keep going on and on and on, discussing the nature of the problem so that we can solve it. Solution-focused is a slightly different approach. Well, not slightly, I would say it's a radically different approach in that we do not discuss the problem at all. It is not that we prevent the client from talking about the problems. The client is free to talk about the problems, but we as therapists do not talk about the problem. In fact, we try and bring the client gently back to the solution. Because experience has shown us that solutions normally need to be built and developed independent a lot of the times of the problems that they are intended to solve. One example I'll give you. If I give somebody a relaxation exercise, the relaxation exercise involves a set of activities that have nothing to do with anxiety or how the anxiety was caused and what is maintaining it and so on. A relaxation exercise involves a different set of activities. An inventor, when he invents something, is looking at the materials, is looking at how these materials will be put together, is looking at the structure of the solution and how this invention or this solution is going to be developed. Like, for instance, when Thomas Alva Edison was inventing the light bulb. What was the problem he was trying to solve? The problem, obviously, was darkness at night. But if you think about it, building the solution, developing the light bulb did not have much to do with the nature of darkness at night. Edison was more involved in looking at what kind of glass was to be used for his invention, whether or not there would be vacuum inside the light bulb, and whether or not it would be tungsten or some other material that would be used as the conductor of electricity that would then turn into light, and so on. So the same way this therapy looks at the solution. More recently, I was working with a client with Asperger's who talked about breathing space. And I thought this is a very powerful metaphor for solution-focused brief therapy. I asked him, how long a breathing space do you get from your ruminations and compulsions and other problems that you have? And he says, well, every month I have at least 1 to 2 days of breathing space when there is no bombardment by these ruminations. And I asked him, how would he feel if this breathing space was increased from 2 days to 5 days, to 7 days, to 15 days, to 25 days? And maybe we could leave 5 days that are full of problems and ruminations and so on. Well, this is just one example of how to conceptualize solution-focused brief therapy. We look at the breathing space. We look at what works. We look at what is working for the client. We look at client strengths. We look at client's potential. Let's talk about some of the assumptions of solution-focused brief therapy. The first assumption is that change is always happening. Change is already happening. It is constant and inevitable. The client is constantly changing. The therapist is constantly changing. The therapy is constantly changing. And the client is changing with or without therapy. So that is the first assumption we need to make, contrary to the idea that client is somehow stagnant or static in one place, and the therapist is in fact helping him change. So that assumption is no longer valid. The second assumption we make here is that client is the expert on his or her problems and solutions. The therapist is not the expert. It is the client who's the expert. And by that assumption, we're also assuming that client's ecology is extremely important because client knows their environment and the therapist does not. The client knows what the relationships are like. The therapist does not. And therefore, the client's opinion and the client's view of the situation is extremely important. Another focus that we have in this therapy is on present and future as opposed to the past. We find history useful sometimes, but in solution-focused, we don't worry too much about history. We look at future goals. So it's not so much causality, but teleology that we're interested in. And therefore, the language that we use in therapy should be in the present tense or in the future tense as much as possible. We focus on realistic solutions, what is possible and what is changeable. And a small amount of change is needed at any given time. We focus on producing very, very small amount of change because we know that this small change can lead to huge changes in clients' behavior and environment. So the small is the secret to the big here. Little change is what is needed at any given time. And that is all we want to produce at any given time in therapy. We also make the assumption that clients want change. You know how therapists talk a lot about resistant clients and how their clients won't change no matter what they do. We make the assumptions that clients desperately want change. They just don't know that it is they who hold the key to the solution. And therefore, they're looking for solutions outside of them. Sometimes in medication, sometimes in therapists, sometimes in psychiatrists, and so on. But it is they who hold the key to the solution. And it is our job as therapists to help them become aware. We also make the assumption that the current problems that the clients are experiencing are in fact the solutions that clients have created. Their obsessions, their anxiety, their depression is in fact a solution they have created to deal with their problems. So we say that clients' current solutions are the real problem. So how do we help them solve it? First of all, we help them notice the exceptions. We help them notice the breathing spaces. I call it exceptions rule. So behaviors, perceptions, thoughts, and feelings that go against the problem. See, when you're not feeling depressed, when you're not feeling sad, when you're not feeling anxious, what is happening then? When you're drug-free, what is happening then? We ask the client to look at that breathing space, to examine that breathing space, and discover their own solution. So we typically start a therapy session with the miracle question. You go to bed tonight, while you're asleep, unbeknownst to you, a miracle happens and all your problems disappear. You wake up in the morning. How do you know the miracle has taken place? How are you different? What do you see yourself doing? We can also ask the same question in a different way. Instead of asking the miracle question, we can ask them, what do you want to accomplish as a result of this therapy? What desired outcome will have been achieved when the therapy is successful? Or simply, What are your goals from this therapy? Then a follow-up question will be, how will the most important or significant person in your life know that the miracle has taken place? So here we explore with the client how the significant others, how the important people in their lives, how their friends and family will notice those changes. And that way we help them establish the ecology around the solution. We also want to explore clients' own solutions in the past. So we could ask them, how was it when you were problem-free? What was different? And then finally, we ask them, which bit of the miracle is already happening? Which part of the solution is already happening? So these 4 questions are the main technique that is deployed in solution-focused therapy. Then we also use scales, but I'll talk about scales at another time. For now, I think it suffices that we understand the nature of the questions that are asked in solution-focused brief therapy. I will continue talking about solution-focused brief therapy in my other videos. Until then, bye-bye.